Ear disorders in dogs. Ear ailments have a multitude of causes. There are predisposing factors, such as hanging ears and a narrow ear canal, that make the dog more susceptible to ear disease. The ear includes the outer, middle and inner ear. The outer ear is made up of a pinna and an auditory canal. The outer part of the ear canal is vertical, then becomes horizontal just before reaching the eardrum. The length of the ear canal varies depending on the breed, between 3 and 10 centimeters. The surface of the duct is covered with skin, as is the rest of the body. Different glands in the ear produce earwax, and the number of glands varies between breeds and dogs. The ear has a self-cleaning mechanism that removes earwax and dirt to the outside of the ear through the ear canal. Behind the eardrum is the middle ear, which is a cavity filled with air. It is in this area that the ossicles are located, the hammer, the anvil and the stirrup. In the middle ear is the inner ear. The inner ear includes the organ of hearing and balance. Outer ear disorders in dogs. Causes. Several diseases can cause inflammation of the ear, such as parasites, like ear mites, certain allergies, foreign bodies and hormonal diseases. It can also be a skin thickening problem if the dog has polyps or tumors in the ear canal. Among the aggravating factors, we can note a strong production of cerumen, a strong hairiness of the auditory canal, frequent cleanings or the exaggerated use of cotton swabs. Dogs that often have wet ears like water dogs are at higher risk. When the ear canal is damaged, the presence of bacteria and/or yeasts can aggravate the condition. These microorganisms are therefore not the main causes of inflammation of the ear. Symptoms. The dog shakes his head or scratches his ear. This can also be painful. The ear flaps are red and swollen. An increased production of secretion of varied appearance depending on the type of infection concerned. The color can range from dark brown to yellow or greenish. The ear can also produce a foul odor. Diagnostic. The veterinarian examines the auricle and the outer ear using an otoscope. It is a device equipped with a light and a magnifying glass, allowing meticulous examination of the auditory canal and the eardrum. The secretions are collected using a cotton swab and are examined, cytological examination, under a microscope to detect the presence of parasites. The secretion is stained and examined again under the microscope at a higher magnification factor to determine the type of bacteria and/or yeast. Sometimes a microbial culture is done. Treatment. If the ears are inflamed, they should be cleaned with a cleaning product that can dissolve earwax. The product used depends on the infection and the appearance of the secretion. Cleaning serves to remove earwax and reduce the amount of bacteria and/or yeast. The dog is also treated with drops, also depending on the type of infection. A control visit must always take place to verify that the infection is cured or not. If there are significant changes in the ear canal, surgery may be necessary. For dogs with recurrent inflammation, the underlying causes need to be found. Middle ear disorders in dogs. The most common cause of inflammation in the middle ear is the spread of an ear canal infection that occurs as a result of damage to or perforation of the eardrum. Inflammation can also be caused by a foreign body such as a spikelet that can damage the eardrum and then cause infection. Inflammation in the middle ear can then create inflammation in the inner ear. Symptoms. Signs of chronic inflammation are often visible. The dog has a strong secretion in the ear canal and shakes his head. He may also suffer when he eats, barks or tries to open his mouth. The head may be tilted to one side and hurt when pressing on the base of the ear. If the inflammation has spread to the inner ear, the symptoms can be deafness and problems with balance. Diagnostic. Diagnosis is made by symptoms and examination of the eardrum. Anesthesia may be needed to check your dog's eardrum, especially if your dog has chronic ear problems with narrow ear canals. Inflammation in the middle ear can also occur even if the eardrum does not appear damaged. The veterinarian may then have to perforate the eardrum in order to eliminate the liquid which is in the middle ear. Treatment. A bacterial culture of the secretion is performed to determine which bacteria to treat and their sensitivities to different antibiotics. Treatment consists of rinsing the middle ear and giving antibiotics. It may be necessary to use cortisone to reduce inflammation.